Hi everyone, this is Carmen. I picked the topic of substance abuse. I really wasn't interested in substance abuse, like growing up learning about it, because I didn't never feel the need to, you know, do those types of things. But being around people who've done substance abuse, who have substance abuse in their life and stuff like that, it kind of drawn me into, okay, I think I need to learn about this since I am a social worker and I plan on, going into the mental health field, community and mental health. So it was a pretty interesting topic that I learned about. So hopefully, if the knowledge and information that I'm giving you, if you all are interested in it, hopefully it'll be very entertaining for you. Okay, so here I go. Substance abuse is a long term use of alcohol, drugs characterized by daily intoxication, inability to reduce consumption, and impairment in social and occupational functioning. So you do these types of drugs all the time, like it affects your everyday living, like your everyday life, everything you do. The drugs that you inhibit, like it just takes over, literally. Substance abuse in rural areas. It has been known to be a problem in inner cities for years, but also has been a problem for a long time in rural areas as well. According to Harlan Skinner, an article that I was reading, studies comparing alcohol and drug use between urban and rural residents in the U.S. have reported inconsistent findings. So they haven't been really able to, vary like who's done this more or who's done it more between rural and urban areas. The use of illicit drugs is shown to affect every region of the United States come from large urban areas, but over the past 2 decades, rural drugs use have increased, and that was something that was very interesting to me because I thought that how are rural cities getting their drugs in if it's nothing around them and you have to go a far place, but obviously it's right there. Um, both and Curran stated that a study of residents in 7 southern states found that men and women in rural areas had lower rates of problem drinking all and overall alcohol consumptions when compared to their urban counterparts. Now, when you think of substance abuse, it's also dealing with alcohol drinking and all. It's not just drugs, it's alcohol as well. So people have alcohol problems as well as drug use problems, and that's what I was getting into. Like every time I did substance abuse, it always pops up drugs and alcohol. So you'll see a mixture of this within the PowerPoint. Um, Substance abuse results increased in legal and illegal activities as well as physical and social health issues as far as how they behave academically. Their health status is declining. Their brain structure and like an increase of death has come amongst them from committing suicide or overdosing on drugs as well. Factors contributing to substance abuse in rural areas include like lower education, poverty, unemployment, high risk behaviors, and stuff like that. With policies, some drugs and substance abuse policy address issues as far as drug driving, prescription drug abuse, prevention methods, and how drugs affect specific population. Drug abuse policy in the United States works to help prevent drug abuse and educate the public about the dangers of drugs use and sales. Um, one act that I saw that I was interested in reading upon was the Tribal Law and Order Act, and it is an institutionalized reform within the federal government so that justice, safety, education, youth, and alcohol substance abuse prevention and treatment issues relevant to the Indian con- country remain the subject of consistent focus, not only in the current administration but also in future administrations. So they're going to keep this going so that we could be educated on drug abuse, substance abuse, and more. Um, Policy addressing youth. Swain reported that the youth between the 8th grade and the 12th grade in rural areas are more likely to have abused substances more than twice a day. So they do this. They go like before school, after school, and growing up in high school, like I witnessed kids do like stuff kind of like that. So it was like, oh well, I've seen this before, so it didn't catch me off guard. Um, the tribal law act is trying to keep kids out of courts and jail has been shown to be the best course. So they try and help kids to stay out of jail. So they might give them like community service or something like that. So this helps them stay out of jail. Strengths and weaknesses. Strengths in urban areas would be more like funding, better facilities, more resources. For rural areas, strengths would be like the location within their community so that they won't have to drive a far distance for the programs that they need. Weaknesses of substance abuse programs would be the lack of resources, funding, and inadequate facilities because, in a rural area they have nothing, so they really don't have anything to like pull to them so that they have everything right there. But they might have some. Who's affected by substance abuse? When you think of substance abuse, you really think adults and humans only are affected by it, but teenagers are as well. An article I was reading suggested that at one point in time, rural adolescents were protected from drug use, but also another finding showed drug use was constant across the areas of the country, and they were defined as rural areas. So they probably tried to protect them, but then they saw that rural kids were doing drug use. An advocacy plan for youth. I would say pediatricians should encourage local school systems, incorporate media education into their curricular. In particular, drug prevention programs should be used, to teach them such things like that. Growing up in middle school and high school, we had a program called DARE, and it was drug abuse resistant education, and it talks to us about different drugs and how you should not do drugs, so stay away from drugs. And they always did it like for a drug-free program or Red Ribbon Week or drug-free week, something like that. And they educate kids from kindergarten all the way up to the 12th grade. Advocacy plans for adults, you could go to the AA counseling, check in with the social worker, see if they have like resources, and social workers always have resources, and they will tell you to go to AA or visit your local physician so that they can talk to you about your health and let you know that how at risk you are if you keep on going the same path that you are on. It's time for a change. For a change, you could bring awareness to substance abuse, or to get it noticed to policymakers. You could have like little rallies, protests, something that could be beneficial in a way for them to bring in more funding to rural areas, because people always outlook rural areas. Urban areas get all the shine and spotlight, but rural areas, nobody really pays attention to them. And having people on a higher level just to give support to those, to let them know that they support them 110% and they want them to do better for themselves. And that is it. So I hope you all have enjoyed my PowerPoint presentation, and I hope I've covered everything that I was supposed to, and enjoy and give me good feedback. Thanks.